Good day everyone, I am Luigi, starter from MSU Action 1 and today I am going to perform post-mortem care. So this is the act of providing care to a dead patient. This entails executing numerous actions to cleanse the patient's body while keeping the patient's wants in mind from a cultural standpoint. So, as appropriate, provide information to protect the patient's family and others from contagious infections. This includes individuals who are on respiratory or contact restrictions in several situations. Then, explain to the family that minimum interaction confined to close family members is required to minimize illness transmission. So, before the conduct of the procedure, I am going to gather all necessary equipment. This is to prevent interruption of the procedure once commenced and to save time and energy. So, I have to prepare a pair of disposable gloves, the alcohol, the bandages, the laboratory gown, then the bath basin with water, the disposable pad, the soap, the toothbrush, the cotton balls, the pen and the documentation record, the patient's clothing, the hot towel, the towel which is the cravat, the blanket, the comb, and of course the 3 identification tag. So considerations before, during, and after the procedure. You must guarantee that all necessary equipment is available. Then preparations for a client to pass away include knowing family wishes and the client's wishes. Then during the procedure, always remember proper body mechanics to prevent overstretching or body straining and make sure to do so. Then documentation of the death, requests for organ and tissue donation, and request for an autopsy and consent. Then after the procedure, transportation of the body to the mortuary or secondary care facility, then put away or dispose equipment and supplies used according to the hospital policy. Then things to document after the procedure, the documentation of the death, the care of the corpse, and the washing of the body, organizing transportation for the deceased to the funeral ceremony, then obtaining permission for an autopsy if one is required. First, check the chart for the physician's declaration or certification of the patient's death. So the physician is the only who can declare if the patient is already dead. Okay. Then, ask permission and explain the procedure to the significant others in order for the significant others to know what you are going to perform. Okay, so ma'am, I am going to perform the postmortem care for this patient. Is it okay with you? Okay. Then, ask the family if they wish to remain inside the room during the procedure. This is to allow them to spend time with the deceased. Okay, ma'am, do you wish to stay here while I'm doing the procedure? Okay, you don't wish to stay here. Okay, ma'am, I will guide you outside. Then, perform hand washing and put on disposable gloves and gown. This prevents the transmission of microorganisms. Wearing protective clothing reduces the risk of contamination with body fluids. Then, lay the patient on his or her back with one pillow in place. Straighten body and limbs in supine position. So this is to maintain the patient's dignity and for future management of the body as rigor mortis occurs 2 to 6 hours after the death. Then, remove jewelry or any personal items of the patient and give it to the significant others. So this is for legal purposes and to avoid legal implications. Okay, ma'am, these are the items that I have gathered from the patient, and I think it is better to give it to you. Okay, thank you. Then, gently close patient's eyes, if open, by applying light pressure for 30 seconds. This is to maintain patient's dignity and for aesthetic purposes. Closing the eyes of the deceased is a form of showing respect. Then, remove IV lines, catheters, and other tubes and dirty linens. This is to prepare the patient's body for cleaning. Then, clean the patient's face using a mitten dipped in lukewarm water. This is to clean the patient's face. Then, clean the patient's teeth and gums using a soft toothbrush or suction to remove any debris and secretions. This is to clean the patient's mouth. Then, place cotton balls on the patient's closed eyes, in the nares, and in the outer ear. Then, secure with a tape. This is to allow secretions in the eyes, nose, and ears to be drained in the cotton. Then, secure patient's jaw with a cravat. This is to avoid mouth from opening. Then, drape the patient with a blanket, then remove the top sheet underneath. This is to maintain patient's privacy. Then, remove the patient's clothing carefully so as not to expose any body part. This is to provide privacy and respect. Wash the patient's body if necessary, unless requested not to do so for religious or cultural reasons. This is for hygienic and aesthetic reasons. Then, clean the patient's genitalia and put on diaper if needed or place undergarments. Some cultural practices require that family members cleanse the patient's private area. Then, put on a new or clean clothing. This is to maintain the patient's dignity. Then, tidy or comb the hair and arrange it into the preferred style, if known. This is to maintain patient's dignity. Then, remove the drape and place a shroud. This is used to cover the patient. Then, allow the family to be with the patient. To allow family members to be with that disease. Okay, ma'am, you may now enter, ma'am. You may now be with the patient. Okay, the procedure is finished and you may now enter. Then, place a name tag on the patient's wrist securely. This is for identification purposes. Then, attach a second identification tag to the ankle or grade 2. This provides patients proper identification. Then, cover and secure the patient's body with a shroud. This promotes patient's privacy and dignity as a person. Then, attach identification tag on the patient's shroud or covering. This provides patient's proper identification. Then, transport body to facility morgue or wait for the arrival of the mortician. So this facilitates proper endorsement and transfer of the patient after death. Okay, hello, is it the mortician? Okay, are you on your way on getting the patient? Okay, thank you. I will wait for you here. Okay, I'll hang up now. Then, put away or dispose equipment and supplies used according to the hospital facility infection control policy. Then, remove gloves and apron. Dispose according to hospital policy and perform hand washing. This prevents the spread of microorganisms. Then, document post-mortem activities including time of cessation of vital signs, persons notified and time of notification, list and documentation of valuable personal effects, time body removed from unit, destination, and by whom removed. And lastly, other information required by facility. So this is for legal purposes and proper documentation care. Okay, ma'am. Please go with the patient now and be with him. Okay? Thank you.